This morning, we are supposed to do a recap of yesterday activities, and I'll ask Emily to take us through. And I also hope that the other presenters are available so that we don't take much time, and then we can finish the program today early enough. So welcome all of you, and I hope you had a good, peaceful evening. And I want to take the opportunity to ask Emily to take us briefly through the activities of yesterday. Emily, over to you.
Okay, thank you, Norbert. And quickly, we'll go through the recap, major issues of what came out of the discussion during the meeting. And the first one, Stella, can we have the slides? Yeah, the first issue was for all partners to note. Okay. Take note of the multidisciplinary approach towards training to include training of social scientists. And here we have the lead partners to be University of Uganda, and the training note to include social science element in the MSc and PhD training and mentorship program. I hope we have these people online, University of Uganda, and the training node. We'll share this as an annex in the report for this meeting. And the timeline is immediate. That means if we've not included this somewhere in our work plans, then we have to include them. Then two, the network should prioritize including junior female science from underprivileged countries like Southern Sudan, Burundi, Djibouti. So the major people to take action on this is Work Package 3 and all Work Package leads and co-leads. And this is as and when. When we get calls and when we apply for calls, let us make it a point to much as possible to include the junior female science from the underprivileged countries. 3, promote joint activities with other EDCTP funded networks of excellency like TESA, CANTAM, WANTAM, and this is Secretariat and other, and EDCTP Africa office. Secretariat, just because when we get communication here, we relay it to the various work packages, and this will be us and when. 4, work package leads and co-leads to visit the EDCTP website to get the report on midterm evaluation report that was conducted in 2019, and to take note of the recommendations in this report to improve operations in the implementation of EACCR 3. So there is that report that each one of us is supposed to download from, from the EDCTP website, and we take note of the recommendations as they were presented by Michelle. And this is immediate. Then regular policy briefs and updates to the Ministry of EACC Affairs. We'll be getting information from all of you partners. Send it to the Secretariat, and we shall use this to write a policy brief and updates to our minister. We've already brought her on board, and this will be annually. Then get involved in the Science and Technology Innovation Center of the ESC. This is all partners, and this is when we are invited. We shall continue to push for this. Then all communication teams in the networks of excellency to work together with the Global Health Trials Network to avoid the duplication of the posts on the website to improve visibility of first ESCR and EDCTP network. What are we talking about here? All the communication teams in the partner institutions work together with Dennis, and Dennis will connect us to the Global Health Trials Network so that we don't put the same message on the ESCR website and same message on the TGHN website. 8, the finance and administrators training for finance and administrative officers. We shall agree on this, but this is going to involve all administrators in the partner institutions and finance officers, just for us to understand the current finance guidelines from EDCTP as of September 2020. Then we have to have in mind that there is no registration and tuition fees for PhD and MSc students registered at Karolinska Institute, but other costs of research have to be paid for. So for all work package heads and leads, if we intend to send students to Karolinska Institute, we should have this in mind. That is what my team took note of. If there's anything that we left behind, we can that was omitted, we can take it up at this point. Over to you, Norbert.
Thank you very much, Emily. I think you captured, I would say, if not all, most of what was brought up yesterday. And as you say, if there is anybody who probably feels there's something that Emily is missing, please either send her some note, or during the discussion you can bring it forward. Also, before we start with Dr. Secretariat, I think I also wanted to appreciate the participation of our European colleagues. I think for me, probably this is the first time I've had such large representations, and I can see now that we have good partners, and it's for us now to sort of make sure that we link with them as much as possible, because I think for yesterday they really sort of brought up the support that they can give us. So we need to take note of that and consider that opportunity so that we work with them closely. But I felt impressed by their participation, together with the participation of our other networks in Africa who joined us yesterday also to give us a brief of their activities. So I want to take this opportunity to actually thank them and wish them all the best. And for us is to take note and take that opportunity to help our communities and countries. So with those few remarks, I want to start off with the presentations, and I'll call on Dr. Ben Eaccr to give us a brief about the deliverables for the year 1 for the HIV AIDS note. Bernard, if you are available, the floor is yours.
Yeah, thank you. I think it's me. It is a recap first, which we've already done, and then project management, governance, and budget issues. People want to hear about the money. Yes. Next
Please
slide.
go ahead. I thought you were supposed to have summarized all at the same time, but if you haven't titled those areas, then please go ahead.
Okay. I thought we would be having other issues that maybe would be coming up, so that we include them to involve all partners. But nevertheless, let me go with my presentation. My next slides, please. So this morning I'll be taking you through the project management elements, governance of ESCR 3, and then lastly, the budgets. So for project management, we are well aware of the communication plan that we sent with the approved annex. You know that we have EDCTP Hague office, the Netherlands office, and then we have the EDCTP Africa office in Cape Town, South Africa. And here, the specific grant officer is Madame Michelle Indelu and Saima for the finance issues. So for all issues related to ESCR 3, we seek guidance from Michelle in Africa office and Saima for finance issues. And then if it is not solved at that stage, the Africa office seeks guidance from the EDCTP Hague office in Netherlands. And then we have the Secretariat. We have the Secretariat where the overall project coordinator, Professor Pontiano Kalebu, sits, based here at UVRI in Uganda, Entebbe. And to support the project coordinator, we have the scientific liaison officer, who also doubles as the HIV node coordinator. That is now Work Package 1, Dr. Ben Chikaire, and myself, the project manager. Then below, we have the Work Package heads in Tanzania, Uganda, and other countries. So what do the work packages look like? Unlike the other past 10 years for ESCR 1 and ESCR 2, ESCR 3 is clearly laid out by work packages. So the first work package 1 is HIV, and the work package lead is UNRO, and the co-lead is MRC London School UVRI. Work package 2 is malaria, and this is led by ARCH, and the co-lead is University of Oxford. Work package 3 is training. Training, we have Good Samaritan Foundation, KSMC, in Kilimanjaro, Tanzania, and they will be working with Radibot. Work package 4, that is neglected in infectious diseases. We have Camry Center for Global Health Research, and these will be working closely with the Institute of Endemic Diseases, that is University of Khartoum, and the Amsterdam Institute in Netherlands. Work package 5, we have TB. Please get the work packages clearly. We are moving away from notes. So 5, we have TB. And work package lead is NIMRI, headed by Professor Mfinanga, and they are working together with University College London as co-leads. Work package 6 is coordination and management. This is UVRI here, deputized by KSMC, where we have Professor Blandina as the deputy coordinator. The names of the heads and institutions are given clearly. Yes, get the names and the contacts clearly. So work package 1, we've already said Dr. Chikaire. Work package 2, Dr. Peshu. Work package 3, Professor Reginald Kavishe. Work package 4, Dr. Eric Mock. Work package 5, Professor Godfrey Mfinanga, and work package 6, that is coordination, everything to do with coordination and communication. Please note that work package 6 was put together with communication. This is Professor Pontiano Kalebu here in Entebbe. And as we said, all communications from EDCTP are directed to the overall project coordinator, and the overall project coordinator then sends the communication to the work package heads for action and information. Some of the issues we get from EDCTP are for information that we relay to other institutions, but it may also be for action. Then all communication and concerns from the work package heads to EDCTP is relayed through the overall project coordinator after consensus from all partners. Some partners were worried about this clause. Yes, we get consensus in the project implementation committee, then we draft a letter that we send to EDCTP for guidance. Then still a bit of the governance. What are the governance structures like? This time around we have the Scientific Advisory Committee, the SAC, and the SAC guides the Project Implementation Committee, which is the Work Package Committee, on matters of science and policy. The SAC is composed of 9 senior researchers to be nominated by the Project Implementation Committee. Yesterday, Dr. Chikaire hinted on that. We shall be, at the end of this day, nominating members to the SAC so that we begin business. Then we have the annual general meeting. Yes, at every annual general meeting, we'll be discussing recommendations from the SAC. And then we'll have the Project Implementation Committee. This offers the executive function to the consortium. It is chaired by the overall project coordinator and supported by the deputy coordinator and work package leaders and the co-leaders. Then we'll have the work package committee, which is like the node. This will be, it oversees the implementation of the work package activities. Then we are talking about work package. What is a work package? It is the unit that implements the activities of the project. I've already taken you through the different work packages, and this replaced the disease-specific nodes. So that is the structure that we've been talking about. We'll have the General Assembly, where we'll have the overall project coordinator and institutional leads. And then we have the Project Implementation Committee, which has coordinator and the work package leads. But on the side, we have the Scientific Advisory Board that will be guiding, getting issues from the General Assembly and the Project Implementation Committee. Then we have the Secretariat that is going to do the coordination and communication, and the various work packages from work package 1 to 6. Now the budget, the money, how does the money look like? This is the money from Annex 2, the budget. Annex 2 is the approved budget, that is a schedule, an annex on the signed agreement. So the overall budget in euros for Camry Center for Global Health Research is 580 euros, University of Oxford 104, Amsterdam Institute 80,000 euros, MRSC 140, University of Rwanda 225 euros, NIMRI 562 euros, University of Khartoum 167 euros, Karolinska Institute 114 euros, University College London 540 euros, Radboud 100,000 euros, KSMC, I think I should have made a mistake there. It should be 508 something. Then UVRI HIV node 580 euros, and then the Secretariat 613 euros. Please note that the Secretariat has the money for the annual meetings, including the meeting that we are having, 3 annual meetings, and that explains, it includes travel and accommodation. That explains the higher budget. I need to correct the figure for KSMC. Don't get worried. It should be 580,000 euros. I thank you, and for that, I take the questions and clarifications. Over to you, Robert. Norbert.
Thank you very much, Emily. Apart from the 0 that you have missed for KSMC, I don't seem to see my area. Arch is not there. So I'm wondering whether we are getting 0. The other question is, is a comment. I think you seem to be much more clearer today from the Secretariat than what was happening yesterday. So I'm sure the IT people have done something, because I think your presentation has been very, very clear and straight to the point. And what I was asking is, what is the budget for Arch? I think for KCMC is just the 0 that is missing. Over.
Yeah, thank you, Norbert. Arch, I'm going to, I don't know how I missed out Arch. I'm going to communicate that to you before the end of the day. Let me get to my laptop. I will give you the figure. Thank you.
Thank you. There is a hand from Professor Kavishe.
Thank you, Bernard. Yeah, so you have already raised the point which I wanted to ask Emily. I think we need the clarification on the budget items so that it can be clear right now, so that we move on.
We shall share the budget with everyone. Like KCMC will get your budget with the details in it.
And Arch.
But basically, every partner that is holding a budget will get their detailed budget.
Good, cleared. I want again to thank Emily. I think she has been key to our activities all those years, and I think she continues to support us. I want now to call upon Bernard to give us a brief about...
Excuse me, I had a question. Was raising my hand up.
Oh, Frank, sorry.
Yeah, this is
just
Frank.
Go ahead.
Yeah, just very quickly, thanks for the presentation, Emily. Was just wondering how the role of the deputy work package coordinators integrate or come in within this matrix. Thank you.
I didn't get that clear. Do you want to say it again, Frank?
I was just asking that I think with this fine ESCCR cycle comes, I think, actively the role of a deputy work package coordinator. So we have the work package coordinator or leader, and then there's a deputy, and of course there are also colleagues. So how do these roles play without any form of conflicting? Thank you.
Frank, I think that is work package specific. And the idea is, I think right from work pack ESCCR 1 and a bit of 2, where we had the challenge of the leaders, the fact that most of them are top scientists and they're very busy, they hold quite high positions in institutions, and so activities of the nodes then, which are now work packages, was a bit of suffering, and the idea was to get a second person that could support the work package leader in executing the duties of the work package. So we don't think there will be any conflict. At the end of the day, it's within the work package to be able to streamline their activities such that there's no conflicting, there's no conflict in their roles, really.
All right, thanks,
I mean,
Ben. Thanks for the clarity.
it's just the way we have Professor Pontiano and Professor Blandina. There's no conflict. When one is not available, the other does a great job. And in that way, the network has been able to progress. So it's the same thing with the work packages. Because the leader is very busy doesn't mean work package activities should cease. The deputy should be able to support.
Absolutely. Thank you. Thanks.
Thank you, Bernard. I think I've also forgotten one question for Emily. There is the steering committee, the scientific steering committee. I've not seen, has this been replaced by another, the advisory one or not? Because I don't seem to see it there while it is in our program.
So, no, but
Maybe.
the SAC was, the steering committee was replaced by the scientific advisory committee. And I think this was informed majorly, the composition of the steering committee was quite ambitious, if I may use that word, and bloated in the fact that what's the right word? The credentials for the people that were to be on the steering committee were quite high, and so for EACCR2, I don't remember any year where we had the full composition sitting at once. And so we thought if we went the scientific advisory way and get people to advise on the science and the implementation of the project and maybe get a little bit people of a lesser profile, we would be able to get a bit of more participation. It's one of those things we want to try out and see if it will work, and it's in response to the effect that we had in EACCR2, where it was quite difficult to get the high-profile people attending those meetings. Thank you.
Yeah, thank you, Bernard. I'm just concerned because I've been trying to get somebody, Minister of Health headquarters, to be a member of the steering committee. So again, I have to sort of revise that request again, but that should not be a problem. So probably he'll be a member of the advisory committee.
Yeah, I think that's perfect. I think towards the end of today, we shall be proposing names for potential members to that committee.
Good, thank you. So I think we probably, Bernard, we just proceed with, although I'm seeing a different name, with the presentation about the HIV work package and what the timelines for this year one. Over to you.
Good morning. Yeah, this is Dr. Benjamin Watiaba. We already started a junior scientist, so I'll be presenting under the senior scientist guidance. And I'm presenting deliverables for work package 1, that's HIV. So that will be our outline for today, specifically looking at objective activities, research activities, and the deliverables. As work package 1, our general objective, as we talked about yesterday, is just to build capacity for conducting ICH GCP HIV research in Eastern Africa. And we have the specific objectives, 5 of them. One is to provide support, coordinate, and manage work package activities, as the previous speaker noted about it. So in this, we plan to constitute a work package management committee and to build a research platform that will support ICH GCP HIV research in the region. We also plan to provide training and mentorship to junior HIV researchers and support them on their research career path. Also to provide support for data management in sites, the sister sites which will be participating in the various research studies which will be conducted under this work package. And also finally is to work with communities, policymakers, and the regulatory authorities in the region In this, we shall be also, maybe it will also involve advocating for the research findings. Under the second objective, as I said, building a research platform, we plan to strengthen ethical review processes, and this we are planning to, we have like 2 hospitals, one in the Central and Masaka Regional Referral Hospital and Jinja Regional Referral Hospitals, so we plan to work with their, to improve on their REC bodies. We plan also to conduct 3 research studies, which I'll be talking about, establish a network of junior researchers, and this we are going to work with the different work packages, as the plan is for ESSR 3 is that to build up on junior researchers. So we'll be coordinating with the different work packages and the sister sites to conduct the various studies, and also to continue with the reciprocal monitoring scheme, which was already an active process in the previous ESSR 2, and also plan to train at least 10 more monitors who will support the activities in the various sites. Still in collaboration with the training work package, HIV or work package 1 will also support at least 1 PhD. We hope that maybe the funds will allow also to train 5 master's students, and also we plan also to conduct 3 short studies. Continuation is still under data management. We plan to provide data management support to the sister sites which will be hosting the various research studies, participate also in scientific meetings and conferences, both at a national level and also at an international level, and advocate for adoption of the research activity outcomes by policymakers. I talked about the 3 research studies to be conducted. One, we plan to look at the HIV comorbidities, including the non-communicable diseases and COVID-19. And this specifically, we plan to explore the effect of COVID-19 on the management and care of chronic illnesses. The second one, we are planning to look at M-Health, and this will be like a continuation of what was already done in ESSR 2 by KCRI and in Zambia Hospital. So we are planning still further to investigate the use of digital tools for HIV disease management. And yesterday, a question was raised about the role of social scientists, and I remember Dr. Chikaire mentioned that we have one of the studies possibly which will involve that, and that's the adolescents and mental health. So we have some activities which also will involve the social scientists under work package 1. And that's briefly the list of deliverables for work package 1, and this is for the first year. That's from September to August 2022. So as I said, that under our first objective, specific objective, we are setting up a work package management committee, and that's already underway. Mentoring visit plan. Thank you. Yeah, monitoring visit plans and quality assurance plan for the 3 studies, and that will be due by Feb next year. The incidental findings policy for the 3 short studies to be conducted. We expect that at least due May 2022. Final study protocol was approved by either regulatory or ethics committee for each of the 3 short studies. Still under training, I know they'll talk about it, but also the continued annual mentor-mentee reports. We plan to have at our first study subject approval package by August 2022. Short courses, which we talked about under training, the reports will be due by August 2022, and the annual participation in the World AIDS Day events, conferences, and any other public events. So we'll be submitting reports, and also training of 10 CROs, and finally the annual consortium meeting, which will be there at the end of this first year. Yeah, thank you so much. That's what we intend to do as work package 1. Over to you, Dr. Norbert.
Thank you, Benjamin, for your brief and to the point about your plan for the year 1. Now, the 3 research studies, these are 1 PhD. This is something that will be started this year, or is it for the coming 3 years or something, you know? Or is it something that you hope to start this year?
So the PhD, the PhD will be in collaboration with Karolinska Institute, and I think it's actually under the MRC, UVRI, who are one of our northern partners, much as they are based here. The 3 short studies, I think everything needs to start this year. PhD is long, so, and we have only 3 years, so I think Anami has already started the processes with MRC about that. The 3 short studies, it's collaborative. The mHealth is between KCRI and Zambia. The comorbidities work is basically around, I think it will be NIMRI, if I'm not mistaken, and the adolescent health will be between Kigali and MRC to that effect. So, but they all should start this year.
Yeah, an additional question is the PhD, do we have proposals already done and probably going through the process of review and approval by probably ethics committees?
We don't have the details for that one, but I think, like I said, Anamia has started the processes with MRC, so we hope that we'll try to go as planned, because that's what the MRC wrote in for as their participation. So, and one of those, I think the adolescent health study is the one that is going to form the basis of the PhD, and it seems they've also been doing already some work with adolescents as MRC. So that is going to form the basis of the PhD, and they've already started conversations with Anamia at Karolinska Institute. No, but it seems you're muted. We can't hear you.
The next presentation. Yeah, I'm unmuted. Okay. So the next presentation is supposed to come from me. I've sent my presentation to the Secretariat. I don't know that they have it. If not, maybe I'll just give me a minute to get somebody to sort me out, and then you can continue. I don't know that the Secretariat has my presentation, the video on. If not, let me just set this up so that we can present. Any comment from the Secretariat?
No, but I think get it and do the presentation.
Okay, just a second. Good, thank you. Sorry, I think now you can hear me, I think. Bernard, can you hear me?
Yes, we can hear you.
Okay, thanks. So to get some IT assistance. So I'll just be presenting briefly about our plan for the year. And you'll excuse me because there's still some confusion about the notes and work packages, but we'll sort that out later on. And briefly, as I introduce myself, earlier, I'm Dr. Norbert Peshu. I'm currently coordinating the malaria work package. And I'll just give a brief of what we plan for the year. Now, as a bit of introduction, the work package is coordinated from our center in Kilifi, commonly referred as the Kemri Welcome Trust program. You can now also see that my name is under ARCH. This is a new sort of entity that was formed, but it's still under our program and still supported by the Welcome Trust. And the ARCH basically refers to the African Research Collaboration for Health. And the idea of forming this entity was the fact that quite a number of our staff didn't have a really sort of a legal entity for employment. There are a number who are employed by Kemri, others were just working and being paid. So the ARCH has taken up that responsibility. Now the malaria program has also, or the work package has, as the others, representation from the 6 East African countries. That's Kenya, Uganda, Tanzania, Sudan, Ethiopia, and Rwanda. And then we have various sister institutions. And our main coordination through our teleconferences, emails, and face-to-face meeting where the COVID restrictions allow. We have not had any since the COVID program started, but we can see some levels of COVID going down. So we are just hoping that probably as we get into August of next year, we should be able to have some face-to-face meetings. Now, I used to be assisted by Esther Kivaya as the assistant work package coordinator, and she was based in Kilifi, but she recently resigned, got a different job somewhere else, and we have now advertised the job for that person. Now, the coordinator was also the lead monitor for our center, and the job that we have advertised is for the lead monitor, and that lead monitor will also be assisting in the coordination of the malaria work packages activities. Now, that's why I'm saying there's a bit of confusion. And the malaria work package, we have, I think, 5 or so headings. And the first one is the project management and coordination, which covers personnel and general administration. And I've clearly indicated that our assistant work package coordinator resigned. The position has been advertised, and we are hoping that by the end of this month, we'll have that position filled, and that becomes our first sort of deliverable. And then I think when we met last as a consortium, I think there was an issue which I think was raised by Bernard about having a project administrator who has some accounts qualifications. So we are also hoping that we'll be able to advertise this job and maybe get somebody to take over by January of 2022. At the moment, we have an accountant who also is quite busy, but is the one who has been assisting in terms of linking up with Oxford University to make sure that our accounts reports have been delivered. And I think we've had significant delays, and this is because I think the accountant has been very busy with other issues. So I hope that once we get somebody who has some accounts qualification will be able to assist and get the reports sent to the Secretariat in good time. Our next plan is to hold our quarterly teleconferences to review our malaria work package activities. And we are hoping that we'll have the first meeting this month, probably soon after the launch of the Eaccr 3. We have another meeting in March of next year, June, and we're hoping that, as indicated earlier by Benjamin, there's a possibility that probably in August, we might have the main consortium annual meeting. And we hope that we'll use then that opportunity to also have our work package meeting. So I hope that, as indicated in all these, in these months of November, March, June, and in August, we will be able to make out and have our meeting either through teleconferences or face-to-face, COVID allowing. I've indicated that our annual face-to-face meeting is planned for together with the annual consortium meeting, COVID-19 status allowing. And the second item, that is clinical and epidemiological malaria research, I'll be telling later on that most of our research will be mainly through research by students and all that. And just to give a brief is that malaria continues to strike hard in Africa, and especially among mothers and children, and it still remains a leading public health problem in our East African country. There's need for effective surveillance for malaria cases and deaths to be able to know which are the areas that are most affected. And then we have a problem of resistance of malaria vectors to commonly used insecticides. And then there are countries that are planning to have malaria elimination. And if we have to have malaria elimination in one country, and we have these international borders, it's going to be very difficult for that country. So I'll be letting you know about our plan for making sure that we have some research going on between international borders so that we know what's happening, and if one country has to eliminate malaria, then the other country need to also work hard so that we don't have malaria crisscrossing from one border to another. So we have proposals in that line. Our next item was to have work on malaria in pregnancy, and especially those people who are using the SP for prophylaxis. It has been hypothesized that using SP, you don't clear the gametocytes, and if the gametocytes are not cleared, then become a source of malaria transmission. So that's one area also we need to work on. Now, as indicated earlier, most of our work research will be mainly through MSc and PhD proposals. So far, we have received 7 proposals that have been sent to work package members for review. Some of the proposals have received ethical approvals from the institutions, but we haven't received very many reviews from our members. That's something that we need to push on. But we are hoping, as indicated earlier, to have a teleconference in the 4th week of November, mainly to review these proposals and consider supporting the students. And then we are hoping that after we have cleared these proposals, students or whoever is doing the research will be able to push for ethical approval by January, and possibly transfer funds to their parent institutions by February 2022. And then we hope that in August of next year, we'll be able then to review the progress of those proposals. Somehow the proposals that we have received are mainly from Ethiopia, Sudan, and Tanzania. We have yet to receive proposals from Uganda and Kenya. And it's not very clear why. Probably Kenya, we have some other funding groups. But I think we hope to receive some proposals from Uganda as well, and probably push some candidates in Kenya to come up with proposals, or we look at those students who we have and probably
Hello, Ben. No, Norbert. This is Kavishe.
Can you hear me now? There was a hitch about the network, I think. Can you hear me now?
Yes, you can hear me now, yes.
So I don't know where I read. Can I go back to the proposals?
Your screen is on.
Yeah.
Yes.
Yes, so with my screen, what I said is that we have received 7 proposals that have been sent to work package members for review. Now, some of the proposals have received ethical approval from the institutions. We are hoping to have a teleconference in the 4th week of November to review the proposals and consider support. And then we'll be pushing the candidates to make sure that by January of next year, they have received ethical approvals from the institutions. And then by February, we can then transfer money to their parent institutions so that they can continue with their research activities. And then in August, we are hoping that we'll have either first meeting or together with the main consortium meeting, so that then we can sort of review the progress of the studies. And as indicated earlier, we have received 3 proposals from Sudan, 3 from Ethiopia, and 1 from Tanzania. We are yet to receive a proposal from Uganda and Kenya. So probably Bernard, and from here, I think we have quite a number of PhD proposals, PhD candidates. We'll see if there are any who probably are working on malaria and have not had proper support from either the trust or from other funders, including the IDEAL program. So I hope you have got that statement. Now, under the training and the mentorship, as indicated earlier, we propose to use the research funds to support the MSc and PhD students, as indicated in the item 2 of our work package. And we are hoping that probably by December we'll have some discussion with Professor Kavishe about the training programs, and indicate the deliverables and the milestones that will be attached to those training and mentorship programs. The key deliverables will be probably on training plan, training report, mentorship plans, and reports. We have discussed this before, and we have actually agreed on the type of mentorship schemes that we are going to use. Under the communication, advocacy, and networking, we'll continue to collaborate with stakeholders, particularly the county and national Ministry of Health and universities. And we have discussed that before, so that our members in the different countries make sure that they have the brief the county health departments about the activities of Eaccr. And we are hoping that this will be done by January 2022. And our other plan was to attend the 10th EDCTP forum. Some of this was done virtually, and I think most of the members attended the meeting. So in brief, I think that's what we are planning for this year. I'm hoping I'll get enough support from our team members so that in our next report, we can sort of give progress of what we have done. So thank you very much, and that's it from the malaria work package. Any question?
Thank you so much, Dr. Norbert, for that presentation. I'm inquiring about the call for proposals from Uganda. What method of advertising were you using to reach out to potential candidates to send in the proposals for funding? And if any, maybe you share with us that you can reach out to other people in the country to send in their proposals. Thank you.
I think what happened is that since we have linkage to all our representatives in those countries, including UVRI, what happened, Esther, who was then the coordinator, the assistant coordinator, sent messages all over that we need proposals for MSc and PhD. And it was then upon the candidates themselves to send their proposals through their sort of county representatives. There was nothing like an advert in the media or something like that. It was through our own internal messages. But I believe, and then in our last meeting, I think we also discussed the same through our teleconferences, and we have minutes to that effect. But it is mainly through the county representatives who were supposed to then solicit or find candidates from their own countries, receive the proposal, probably look through them, and then send them to us in Kilifi. That was the system used.
Thank you very much.
Probably you still have time. If there's somebody whom you want to send the proposal, you can still send the proposal either through Bernard or somebody, Peter. I'm forgetting the second name, but there's a gentleman who is called Peter. Kira or something like that. I will look for the name.
Okay, thank you
Any
very
other
much.
questions?
Yes, would you kindly tell us what the timelines are for the applications for the proposals?
We have probably passed through the time because we were hoping that, because we started this early enough, and we were hoping that by the time we receive money from the Secretariat or from EDCTP, we'll have proposals ready, for dispatch so that people start their work early. But this has not happened for various reasons, because we have not been receiving reviews from our members in good time. So probably we can still receive proposals. Maybe we could give it up to January, maybe end of January, to receive proposals. Or, the earlier the better, so that once you send a proposal to, especially for a PhD proposal, whoever is reviewing it needs to take some time. So I would, at the moment, probably put it to end of January, so that if we have cleared that proposal and it is within our funding post and it is in order in terms of whether it is a PhD or a MSc proposal, then we'll be able to support it. Because at times, again, we have received proposals that somebody has indicated they are for PhD, but when somebody looks at it, you feel this is not really a PhD proposal, probably for an MSc, because of the questions that they are asking and what they want to come up with. Because probably for PhD, you need to really come up with something very novel. So probably for now, I'll give it up to January, especially for the Uganda and the Kenyan team. And probably Uganda, Tanzania, because we have already received one proposal from Tanzania. I think for Sudan and Ethiopia, we have received 3 proposals each, and that's what we are working on. Unfortunately, I think the communication between our partner in Sudan and South Sudan has not been very good, and somebody has tried to contact people in South Sudan, and the responses have been poor. So although we are looking forward to support South Sudan and other countries, at times the communication has been an issue. Over. Is that clear? So probably Reginald.
Thank you, Norbert. Yes, I just had one comment. I think one thing is, well, you mentioned that some of the proposals have been ethically cleared, but then the challenge we have is, if these are proposals that have been sent out for as a, sort of application for the positions, then moving on to ethical clearance may not be possible for all the applicants. So I would actually suggest that if possible, you could move forward with awarding the candidates so that those who are awarded, then they can continue with the ethical clearance and other approvals so they can conduct, because it will be not, maybe not good if someone has ethical clearance already and then they cannot do the research. In the sense that in the end, if this is not awarded, then it will be a problem. So I would say that why don't you just move on with the already submitted applications and see who qualify so that they can start in time, and then look forward. If there are gaps, they can fill the gaps. Over. Then, Norbert, you are on mute.
Yeah, sorry. What I'm saying is that there's probably one or two who have received ethical clearance from the institutions, and I agree with you. But again, I think the bigger problem that I'm facing is getting reviews from our own members. I know I've received the reviews from you, but I'll ask other members of the malaria team to get us their comments. Because remember, when we met last, which was quite a while ago, we were hoping, as I said earlier, that by August we should have, reviewed the proposals and actually cleared them, so that as soon as the money comes from Secretariat in September, that was our hope. Our proposals will be ready, for action. So I agree with you. Look through the proposals and see the one or two who have been cleared by the institutions. Once we get the money and we have agreed about where the money has to go and how it's going to be accounted for, then we'll ask our accounts team here to transfer the funds. Thank you.
No, but I have a question.
Yes, Bernard.
Especially around the studies which you say are going to be student-led. I know we are talking about time and a few proposals have been reviewed and all this, but you see there is this whole encouragement and proposal from EDCTP to include the less established countries, the disadvantaged countries. I'm wondering, is there room to extend invitation to some of those countries through links? I'm imagining the people in Ethiopia can link us to at least Djibouti or Eritrea, and the people in Tanzania could link us to Seychelles or Zanzibar, and so we can have some sort of inclusiveness. I know there is a time factor, but if we aim for MSCs, MSCs around 2 years really, so we'd have this 1 year for hunting down those guys, and then hopefully by next year, somewhere mid next year, you are recruiting them onto the process. And I think in that way we are able to to include some of those guys on to begin benefiting from this. I don't know what your thoughts are on that.
Yeah, Bob, I don't know what has happened. I agree with you. We will try. Reginald is with us, so he is hearing what you're saying. He is our key partner in in Tanzania to link up with Zanzibar. The other person is in Tanga. He can easily again link up. That's Deus Shingoma. He can find out somebody from Zanzibar. For Eritrea and Djibouti and the way things are in Ethiopia, I have to probably link up with the people in Ethiopia and see how the situation is because of the current conflict in Ethiopia and whether what are the possibilities of that. But I think one of our members from Sudan tried so much to get linkage with South Sudan, and it was difficult. So we will try, and where if anybody has any form of assistance in terms of linking up with our colleagues, I think Zanzibar should not be a problem. For Eritrea and Djibouti, maybe that can cause some difficulties, but we will try. Well, I think we have to move. If there are any questions, then we can discuss them during the discussion time. I will then ask Professor Vishen to probably give us a brief about the training work package. Reginald. Reginald, over to you. You're muted.
Okay, thank you, Norbert. So, can you see my screen?
Yes, yeah, I can see your screen and yourself.
Try to put it in presentation mode.
Yes. Just a moment. Okay. Thank you. So, good morning, everyone. My name is Reginald Kavishe, but I have a deputy, Vesla Kulaya, who is the assistant coordinator for the training work package. So, I'll take you through the training and mentorship activities. So, in overall, the main objective of this work package is to deliver a training and mentorship program promoting an increase and retention of the independent African researchers, research leaders and managers to conduct internationally competitive clinical trials. Our specific objectives, one is to build specific competencies necessary for bridging existing gaps in expertise for the conduct of clinical studies through well-designed short courses and workshops. And the second one is to leverage the existing partnership and capacities within the network and in collaboration with other nodes of excellence to train a critical mass of scientists at master's, PhD, and postdoctoral level. The third one is to strengthen the Eaccr Clinical Research Associates training through the establishment of CRI training and mentorship short course curriculum for sustainable training and accreditation of Eastern African CRIs. And the last one is to provide high quality supervision and mentorship support to masters, PhD, and postdoctoral fellows across the network. So these are the overall objectives for the work package 3. The planned activities for Eaccr 3 and the work package 3, we have one, a long-term training. This constitutes masters and PhD, but also postdoctoral fellowships. But in this case, we have masters and PhD training within specific research projects. For instance, when work package 1 HIV, there will be at least, I think, 2 PhDs. I may be right or wrong, but no, things changed along as we were developing the proposal. So yeah, just highlighted 2 PhDs, 2 masters. Work package 2, 1 PhD, 2 masters. I know Bernard presented it differently. And then work package 3, we have 1 PhD at least, and then work package 4, 1 PhD and 2 masters, and the last one is TB work package 5, 1 PhD, 6 masters, which were indicated in the project writer. So the candidates will be supported within stipend, research and publication costs, and will be mentored under the training work package. So the next activity, the second activity, is cost-cutting short courses. One, we will have research and financial management, and this will be a train of trainers course targeting 20 clinical research staff across the network. The next course will be pharmacokinetics training, and here we are also targeting about 15 scientists. We have another course on grant writing. Under grant writing, we will conduct 3 different courses, each one targeting at least 15 scientists, making a total of about 45 at least. And then we have molecular diagnostics on emerging diseases, including Ebola, COVID-19, and others. And this is also targeting about 20 scientists. We have a course on bioinformatics and multi-omics analysis, and this was presented by Professor Perrin yesterday, because it's being led by the Radboud University, is our partner. Then the 6th one is we will do, this is not a course, but we will do a symposium. This is meant for dissemination of the data and results coming from the MSc and PhD trainings. And we have the CRI training, mentorship, and codes as well. Under UBRI, the HIV node, work package, we have training of 10 CRIs, but also we have the previously trained CRIs. We agreed that under the AIGHD, we will continue mentorship of the previously trained CRIs to make sure that they perfect, but also we'll try to do a harmonization of the CRI training across the region. So this will be a collaborative activity with other nodes of excellence. There is another training component which includes the data management workshops, but this one is not very clear, and I wish we could hear more about this. I think this is being coordinated under the West of Amsterdam, but these are all the, in a nutshell, the training activities that we anticipate for EACCR 3. So here I only displayed the deliverables and milestones for year 1. So when you see this very brief, don't worry, because here we are only focusing on year 1 as it was communicated from the Secretariat. So here we have the mentorship to PhD and MSc candidates as one of the deliverable, which has to be achieved by month 3 of the project start. And the milestone under this deliverable will be mentorship program booklet in place. So this is something which we will immediately start doing together with our partners. So the training work package team will start working on this immediately so that we have I know we have some drafts already, so it's actually revising the drafts that we have and concretize on it so that we have the booklet in place. And we will develop the system, which shall also include some online components for masters and PhD mentorship. But also, as a milestone, then we'll need the masters and PhD mentorship reports, and this will be coming soon after the program has been instituted. Then we expect that the trainees will be sending out reports, regular reports, quarterly, 6-monthly, and annually to the project coordination. Another one is short courses, training reports as a deliverable. And under this one, we have 3 deliverables. So we have a grant writing course reports, we have research and financial management course reports, and molecular diagnostics course reports for the 3. These are the reports for the 3 courses that we anticipate to conduct in the first year of the project. So as milestone, we have 1 grant writing course, because these grant writing courses are to be conducted on annual basis. So we will have the first one in the first year, and this is to have been conducted by month 7. And also the research and finance management course should be conducted by month 5, and the molecular diagnostics course, which also need to have been conducted by month 10. So these are the short courses that will be conducted in the first year of the project, and we will anticipate then as a means of verification, we'll make the reports, we'll submit the reports to the Secretariat for the courses. So, in short, these are the deliverables and milestones for first year for Work Package 3. Thank you. Over to you, Dr. Peshu.
Yeah, thank you, Prof, for that brief report, and just hope that we'll be able to manage and have the deliverables as required. Now, you put up a list of MSc and PhDs and the different work packages. It was not clear to me whether this is just a report, or are these the ones you are going to support under the training work package, or is it just courses or candidates who will be supported by different work packages? It was not very clear.
So it's all the short courses that will be conducted under Work Package 3, but some of these are coordinated from other institutions. And even you see the long-term training, the masters and the PhD is also inclusive. It's including the trainings that will take place in other institutions. So I've put everything under the Work Package 3 on that slide.
Yeah, Rignold, thank you for that. I think I almost have the similar issue as Norbert, but mine is more of, because I can see different groups have different number of PhDs and MScs. I think, if I remember well in the budgets, there didn't seem to be that much money proposed to support those many long-term trainings and maybe even short-term trainings. So I know you've probably collated from the different work packages, but maybe the idea is we need to be very sure that we are all speaking the same language. Otherwise, when it comes to reporting, Michelle will require us to produce evidence of those PhDs when they actually don't exist in the budget, so it becomes a very interesting dynamic to deal with. So maybe there might be a need for you to work with the other work package leaders to be absolutely sure they have the budgets for that, or at least they have plans of finding budgets for those trainings.
Yeah, thank you, Ben. You are very, very right. You know, I put that slide purposely because I want us to be sure of the numbers. So I put that so that I can, kind of stimulate the discussion, and of course, we need to know the correct numbers. So you are very right. So we need to get the correct numbers from this, because I actually picked these numbers from the project, from the project proposal. that was approved. So I think we need to streamline because there were revisions on the budget, and therefore it's important to streamline and come up with the correct numbers so that we can communicate this to the funder, because otherwise we will be in debt of those. So I think I'll be very happy, and I'll actually communicate this with the other work package leaders so that we get the correct numbers. It's good for us to properly document. You know, in Eaccr2, we had a similar problem because we had a number of trainings which actually did not happen in the end. And this was also due to cuts in the budget. And therefore, in the end, we were being demanded to submit reports on things which did not happen. So I think it's good if we can iron out early before it becomes a problem. Thank you. Over.
Ben, do you allow me to comment?
Yeah, allow Dimazi. Go ahead.
Yes. I think the discussion is actually taking the direction that we need to quite agree from the very beginning. For example, Prof. Kavisha has mentioned very clearly, and I agree with the fact that in Work Package 4, we have a PhD and I think 2 or 3 additional MScs. But then now we should also rewind back our mind and see at the proposal writing stage that most of the work packages were having their research and clinical trials around these students. So what that means is that if, for example, we are talking about work package 1, which is HIV, and their students, they have the budget plus the research, plus the supporting research. So if I got Prof. Peshu, your very original question was apart from just making sure that the numbers tally for purposes of report, then there should be separate, probably, students that are supported by training nodes, so that other work packages also have all this, but then just, like adding up to what the training node does. Otherwise, for work package 4, I'm pretty sure that we are trying to get the researchers around these students, and therefore they're supposed to be catered for within the work package. Over to you, and I hope I'm clear.
Yeah, thank you, Bazi. I think I do agree that the training node probably, we need to know from them whether there was separate sort of budget that they cover for probably their own candidates for PhD and MSc, because I think what Professor Kavisha has presented is probably, he has picked it from the different work packages. But it might be good to know whether, as a work package on training, whether they have a specific few candidates who they are just actually supporting in full. Over, Reginald.
Yeah, thank you. No, I think...
Sorry, my name was coming out as Mbazi. This is Eric, huh?
Yeah, I was wondering, this voice looked different compared to the name. I was wondering.
I just really kept calling me Mbazi.
Yeah, Eric, you're impersonating someone. but I think the idea is brilliant.
Yeah.
We need to be absolutely sure there is money. There is the idea you raise of students who will do the work on the research. So I'm assuming you did budget for the studies as well. I've not looked at the individual budgets in detail to see what is there. And because there is a stipend for the student, and then there is the research fees. So for instance, I'll give an example. For us, I'm familiar with the MRC one. So the MRC, the research fees, which are going to cater for the adolescent health, is what will cover the research fees for the PhD student. And then we also wrote in a stipend for her. So that kind of, we think should be adequate. And then the other money was deposited at Karolinska Institute to support the students' time at Karolinska Institute. So those budgets are kind of separate from what is with us as UVRI Work Package 1. And we think that budget put together should be able to to see this student through for a PhD. And then for the MSCs, and I was quoting Benjamin when he was preparing, I think we made that mistake. What I can see in our budget is just for one MSc student, and it's a stipend. So that stipend now might go to support one student who probably will do work on the maybe the M-Health study, so that the research fees now are covered by the research fees for the M-Health study. But now if in the write-up we wrote 5, but in the budget we have only stipends for 1, then you know there are issues there, and that's why I'm saying that we probably need to visit this, and maybe Rignold, you can tell us if as a training node or training work package you actually put aside some money to specifically support some long-term trainings as the training node. Thank you.
Yes, Ben, just to say something, I think that was even the spirit at the time. Even though I know there are work packages like mine that we have a PhD, and probably we were not able to fit into the budget, research money, but then we would then look for other projects that would support the PhD. But the spirit was, and I remember this very well, that long-term trainees that were indicated per work package, all those other short clinical trials or researches that would be done were around the MSc and PhD students. And therefore, as much as those numbers end up being reported partly as training node, then training node must also have their own independent, mentorship and training group. That is my thought.
Yes, this is Kabishe. Yeah, I think I quite agree with Eric that the agreement really was that the PhDs will be supported from the research projects. So, because we agreed that this project, Eaccr 3, was more on research than for pure postgraduate training in the sense of masters and PhDs. So we agreed that we will book masters and PhDs within the project. And that's why, for instance, when you look at the training work package, the work package 3, we didn't have research on our side, and therefore we did not have PhDs and masters in this side. We've tried to book in one master, one PhD, specific on the multiomics training, but actually we just realized that the budget would not even support that one. So we have to, let's say, look for some co-funding elsewhere to support that PhD. So most of these PhDs were on the ongoing projects. And therefore, I'm pretty sure that those work packages with the research projects should be able to support masters and PhDs, because we want these PhDs and masters to be the lead in the project, and therefore in that way they are supported automatically through the projects. And the issue of stipend, we know very well how to deal with that. I don't want to repeat, but I think we discussed that several times, and we agreed how best we can handle the issues of stipend of students working within the projects. Over to you, Dr. Peshu.
Yeah, thank you, Prof. I think we have to move. Time is not with us, and we have to continue discussing some of these issues, and probably have another teleconference soon to discuss these issues of supporting PhD and MSC's candidates. So I will now call upon Dr. Eric Mwoki to just give us a brief. I know there's a burning question from Ken. Is it something that can wait, or you want to ask now?
Yeah, I mean, I thought this would be the appropriate time to ask it now that there are discussions around the PhDs and the MSCs.
Okay, we can give you a minute, yeah.
Yeah, very, very quickly. I think it was not very clear to me from the other work packages, and I know Eric is here to present on his work package, how the selection process for the MSCs and PhDs happen. Because at least from your end, from the malaria work package, I got the sense that there was a call and, you're soliciting for proposals. Yet it wasn't very clear for me, for instance, the HIV node, component and the other components, how the selection process happens. So, thanks.
Yeah, maybe Bernard can give a brief of how they did it from their end, and I think I think from the for the HIV node, maybe Bernard can say something, but for the TB node, I think I've waited for Professor Finanga to give his presentation, and then maybe we can also ask him that similar question.
Maybe we can get a response at the end when all the nodes are done.
That's right. Thank you very much for that suggestion. Dr. Moki, over to you.
I'm sharing already. Can you see my slide?
Yeah, we can see the slide.
Yes, that is. That's just the cap.
There's a lot of interruption. I don't know whether it's from my side or not.
Probably. Yeah, and I was actually trying to do the chemical colors on the background. I will also apologize that I've been a bit under the weather. I know some of my colleagues are surprised that I have a presentation anyway. So this is work package 4, the one that we previously called the NID node. So in the work package 4, just to highlight a few that is not shown there, part of our objectives as a node is that we are the youngest child on the block, and strengthen. We thought that was something that we could do in the first 100 days of ESCCR 3, and part of that would be to probably recruit some of the supporting staff alongside the coordinating office, and of course, as a node and the spirit of the network itself, we also uphold, the idea of consensus building among the participating institutions, and also at the same time, have progress reports submitted in a timely manner, and having at the very least, 6 monthly or biannual meetings, either or virtually or physically, where opportunities present themselves. We also plan as a work package also to submit our work plans, budgets, technical progress reports, and financial reports to the Secretariat in a timely manner. Specific trainings, as Prof. Kavise and my colleague who talked ahead had indicated that we had those work package specific trainings. So those, again, I will highlight later. And also to ensure that we have co-funding activities, trying to develop proposals and trying to look for additional funding to support some of the areas that we have just talked about, including the long-term trainees. So I thought this was also a great opportunity for me to try to highlight who we are, as Emory CGHR. We are actually called a Center for Global Health Research, which is located in the western parts of Kenya. And of course, we have gone through a lot of metamorphosis since the beginning in 1984, where we've been named differently depending on our ever-changing mandates to accommodate what are the world pressing needs in terms of global health. And very quickly, we have mandates that are actually drawn from our major institute, which is Kemi, that we also have, as a center. And part of our mandate fits very well with what with the network, looking at epidemiology and control of infectious diseases, including having studies that cuts across molecular biology, immunology, and genetics, vector diseases, clinical trials, climate change, and behavioral sciences. And of importance currently are the emerging and emerging infectious diseases, including COVID-19. So we are also involved very strongly in capacity building and, of course, mentorship which is part of a very big component of the Eaccr network. And we provide leadership in terms of corporate governance, which is we also promote here, and even promotion of sustainable excellence in research. And dissemination is a very big component of our center and Cambridge as well as translating research funding into policy formulations. As we can see, as we will see later, in our work package, dissemination and technical working groups is a very big component that we want to strengthen this time around, so that we get to know that whatever it is that we get in terms of research findings are also incorporated into policy. We also strengthen research partnerships like the one we are in today, and also have a very strong, collaboration with us. Part of the diseases that we cut across, we realize that we are in HIV, and therefore in this sector we coordinate with the HIV work package, Hiv work package, of course our neglected tropical diseases and malaria, which is with our sister center in Kilifi. We're also involved in biotechnology research and health systems, alongside others. So we have had some other, achievements have passed through, but we also strengthened partnerships, collaborations, communications are essential, plus research, growth, and also making sure that we are level with the rest of the world in terms of competitiveness in research and delivering, up-to-date information that changes policy. So back to our NID work package. That photograph is a bit familiar, but it only shows what impact NID has, the global impact, cutting across, as far as the WHO statistics. So particularly, before I get into what we are going to actually do as a work package, and I have put in year 1, year 2, year 3, because there are some things that actually cut across. For example, if we strengthen management of NID as a work package, then that cuts across the whole 3 years. We could not continue strengthening, but it is strength and it manages the work package. Then when we get a start of long-term trainings like PhDs and MScs in year 1, then we expect that the PhD will close in year 3. That then cuts across the 3 years of Eaccr 3. Then something like dissemination is also at different levels. And of course, MSc, when you're able to start in the first probably 100 days of year 1, which may not be very reasonable because we already passed, several days, probably in the first half year of year 1, then we expect that person to have to finish probably by end of year 2 or early year 3. Dissemination is cutting across as well. At every other time data becomes available, it can be disseminated whether in year 1 or year 2 or year 3. Then we have specifics for year 1. For example, Prof. Kavisha had already indicated that there's a molecular diagnosis training that is housed under work package 4, and that is indicated for year 1. And this will be done by our sister institution, KCRI. Then again on year 1, we have the genotyping and genomes training, which also will be implemented in year 1, hopefully. And that is targeted for Addis Ababa University, where we had the initial training for that. So this could be like, the model 2 of it, or probably if we agree that that is done, like a repeat of the same to cover for a wider group, then that's fine. Then, of course, continuing activities that we do, just highlighting the very important ones, participation in technical, national, and international technical working groups on NTDs. This is something that we already started in Eaccr 2, and this is supposed to continue plus advocacy, as our previously we used to call, that also continues along the several years. A few highlights includes indication of organization of a conference that is in year 2. And it's very clear in my mind without looking at the proposal that we are going to conjoin with the national NTD workshop that happens in Kenya annually and we are going to be, partners in that organization that cuts across the whole region. Then, of course, in terms of short-term trainings, we had indicated NIMRI to have rapid response training in year 2, and our new child in the block, the University of Rwanda, will be conducting ethics and pandemic response, and that will come way back in year 3. So, just highlighting the very key points, those are some of the things that we've planned to actually do as a work package 4. Unless I have specific questions. So one of the things that I need to mention at this point is that we have Professor Mawea. I'm not sure if he's in here. And there was a very strong advice at the time of proposal writing that we needed to have work package leads and somebody who works as a supporting lead. And work package, Professor Mawea, who was the very original lead of this node, when it was still called a node, is actually indicated as supporting, and I'm honored to have him still around supporting the EACCR, because I'm also getting lots of mentorship from Professor Mawea. Over to you, Prof. Peshu. That is the short highlight we have for the work package 4.
Thank you, Eric. I think you have a big mandate as the Center for Global Health Research, but considering your current sort of responsibility as far as the EACCR, I think, is concerned in the fact that you are hosting the NID node. One question probably is what Ken had asked earlier about if you have a system of advertising for PhD. But again, I also wanted to ask you, as far as NID, components are concerned, are there any specific research proposals that are addressing the diseases that we are considering as NIDs? But the other one is what Ken had asked about how we are advertising our PhD and MSc sort of openings.
Yes. It's something that actually keeps my mind. I think it's the only thing that is different from what you actually highlighted is that we are a little bit late because we needed to be sure that what went into the proposal actually came out. We all understand that there's what goes in as a proposal and what comes out as an NOA, notice of award. So we have not gone through our advertisement for the PhD, but I don't see anything different from the process that Kilifi has taken. Like you see, for us, our universities is that for PhD specifically, you need to develop a proposal that then is actually approved by the university before you get admitted. And we will do an advert with the thematic areas that we think our PhD should be running around. As a case of MSc, we, as usual, will engage with the training, the training work package, Prof. Kavishe, and do this, region-wide, because they are not restricted in Kenya. There are people who are supported from all participating institutions. So Ken, I know that answers your questions, so you are not time bad. We will provide the thematic area and do, the announcement. Then going back to your very important question, and I try to explain this again, that the way NID work package was developed is that the diseases under NID as a priority, the researches will be done around the students. And I think this was the spirit at the time when you were writing this, that if you have a PhD student in an area that is working on probably One Health, and some bit of COVID-19, then most of the little funding that is available to do any research activity works around the student. So that then was muted at the time as a way of using one stone to kill two birds, so that we don't have parallel short projects running and students running parallel. It becomes a bit difficult to manage, but also at the same time, I think we get more value for money when we are paying stipend to someone who is doing, the priorities search of that work package. At least my understanding from the very beginning was that one. And I have my colleagues also in the meeting. I saw Jafu here. If somebody has anything to add that I'm saying that is out of place, then you are actually welcome. Over to you, sir.
Thank you, Eric. Jafu Mwanza, any comment? Any other comment or question to Dr. Mwoki? If not, I think we'll have to proceed, and I hope Professor Mfinanga is online or somebody representing him, because the next one presentation is on the TB work package. I can see Mbazi trying to, good, thank you.
Yes, Prof. I'm here, but Professor Mfinanga is also online, and he's the one who's going to present. So yeah, let's move.
I will just upload my slide right now. Just a moment. Yeah, it's okay. Can you see my slide now?
Yeah, we can see the slide.
Okay.
Yeah,
good,
we can hear you.
Okay. Thank you so much.
Most welcome.
So my name is Professor Sayuki Mfinanga. I work for National Institute for Medical Research at the Muhimbili Center, and I coordinate Work Package 5, which is dealing with developing clinical research capacity for tuberculosis. So I'm making this presentation on behalf of Work Package team, Work Package 5 team, and I will briefly present on our planned activities. So our objectives, the work package objective focus on strengthening and enhancing sustainability of mode of excellence, human resource capacity, updated GCP compliant data management platforms, and expand south to south and north to south collaborations. For now, the collaborative members of the Work Package 5 include the National Institute for Medical Research, we have Kilimanjaro Christian Research Institute, we have Kenya Medical Research Institute, Kisumu Center, which is participating in this work package. We have Addis Ababa University in Ethiopia, Infectious Disease Institute in Uganda. We have Institute of Endemic Disease in Sudan, And we have University of Rwanda. This is from Rwanda. So in the next like 3 slides, I will show you the detail of our 12 deliverables. The work package is deliberating on. I won't go into detail of each one, but you will realize that we have deliverables covering establishing oversight mechanism for the work package, communication, deliverable for clinical research development. We have deliverable for strengthening up-to-date joint functional and sustainable online data management platform. We have deliverable for strengthening capacity for human resource in conducting GCP compliant clinical trials, including bioethics international standards. And the capacity will focus in clinical laboratory and data management. We have a training strategy, which include short-term and long-term strategy. In the long-term strategy, we include mentoring fellow in conducting clinical research projects, which include 1 postdoc, 1 PhD, and 3 masters. We are also discussing on how we can support the junior scientists to be able to conduct the clinical research. We have milestone. We have indicated 2 key milestones. Tracking first and last participant enrollment in various clinical research project under our mentorship program. But within these 2 key milestones, we do have sub-milestones that will help us to achieve those 2. And these are such as regulatory approval for timing for regulatory approval for clinical epidemiological research, timing for training on ethics, regulatory, GCP issues, timing for mentorship for the postdoc PhD and master's enrollment, and like specifically customized multi-site database platform for each trial within the package. So that's how I could summarize our milestone. We do have a plan, but you will realize that in this schedule, most of our deliverable will be realized in the last 2 quarters of the 3rd year. So with that summary, I thank you for your attention, and I'll be ready for discussions. Thank you, Chair. I submit.
I'm sure there might be a few questions here and there. Thank you for the brief report. I wanted to ask about the postdoc. Is that part that will also be funded by the EACCR, or is it something outside the support that EACCR? Because I mean, the idea is probably to support junior researchers other than recruitment of postdoc researchers. And then the other question probably related to what Ken has been asking about our recruitment process for PhDs. Over, Prof.
Thank you. So we normally do advertise for the posts that we are intending to do. But the way we are doing our postdoc is centered more on mentorship. So we are trying to come out with projects that are somehow connected with each other in such a way there will be a portion that can be conducted by the postdoc, but this postdoc should mentor PhDs, should mentor masters. It's cascade of mentorship, while the postdoc himself is being mentored by senior people in the work package. Several senior people, professors, and so on. So that we strengthen or we foster networking of our fellows from the master, PhD, and so on. So it's not like full-time, really, postdoc. It will be based on time effort, but it will be on potential candidate who really has good PhD and already good experience in research. And by the way, coordinating the node, but Dr. Mbazi is deputy, is helping me with all the coordination work. I don't know if I have answered correctly your question, Chair.
You probably Bernard will comment on this, but I'll ask if there will be another question to Professor Mfinanga. If there's no question, I think we just have to move ahead. And for now, I think we are probably on our last presentation, and this is basically from the Secretariat level on work package 6. And this is to Josephine and Emily. Over to you, Emily.
Is it on?
We can't hear anything.
Hello.
Hello.
Hi, everyone. My name is Josephine Nasali, and I'll be presenting for Work Package 6. I'm the M&E officer for Eaccr 3. As I wait for the...
We can't hear you. You either need to raise your voice or get closer to the microphone.
Can you hear me now? Hello?
Yeah, we can hear.
Yes, please go on, we can hear.
Okay. So my name is Josephine Nasali, and I'll be presenting for Work Package 6. I'm the M&E officer for Eaccr 3. So Work Package 6, basically the main objective is to coordinate, support, and manage the project activities for all the work packages, which are 5, as they've been presented here. This is the coordination office at Secretariat. Thank you. Yeah, so the main objective is already stated. The specific objectives is to ensure compliance with the contractual obligations as laid out in the grant agreements. Yes, and the next one is to facilitate transparent communication and decision making for all work package leads. We are also supposed to ensure timely financial and technical reporting to EDCP. And then the last one is to ensure active engagement and linkages with EDCTP-funded consortia, including the networks of excellency. Next slide. So the Gantt chart projected there is for the activities for Work Package 6. And the first one is to monitor the network's compliance to grant agreements and consortium agreements, i.e., we have to ensure prompt signing of the grant agreements and consortium agreements between the partners and the UNRO. Then these will be shared by EDCTP. I think this was already done. Number 2 is to institute management bodies and structures in Eaccr 3, i.e., the scientific advisory committees, the PIC, and then the work package management leads. I think today we are instituting the scientific advisory committees, right, Emily? Today? Okay. So activity 3 is to institute internal monitoring and reporting structures. Here we shall modify and adopt the internal monitoring tools to serve the purposes in Eaccr 3, and this should be done or run up to the second quarter of year 1. Activity 4 and 5 are continuous. They will run throughout the year 1, year 2, and year 3. That is periodic reporting to EDCTP, financial and technical reports. And then we shall also have a revised communication plan that will support efficient implementation of project activities. Okay, so the deliverables and milestones for work package 6, basically launching the project which is happening, that is supposed to be in the first quarter, and then the continuous annual consortium meetings which will run at every end of the year. The procedures for immediate reporting of breaches, i.e. data integrity and misconduct to EDCTP, we need to have these procedures done in the first quarter. An updated consortium work plan for the project and ME framework. This is supposed to be in the first 2 quarters, then continuous reporting at the end of every year. We need a charter of decision-making and advisory bodies. This is supposed to be done in the first 2 quarters of year 1. We also need to have a strategy for promoting young female scientists. I think this is where the discussion has been mostly when all the work packages were presenting. An updated website and activated media accounts for the junior scientists that we are going to have in Eaccr 3. This should be up and running by end of year 1. We need a directory for the key stakeholders and policymakers that we are going to engage in Eaccr 3, and this should be also out by the second quarter. And so the last slide of deliverables will be to have a revised communication work plan by end of quarter 2, a dissemination and exploitation plan with a communication tool. Also in year 1, end of quarter 2, report on the annual stakeholder engagement meetings while introducing the project. Publications from all work packages in open access journals. Yeah, we need to have these publications at every end of year for the 3-year project. OCAD accounts for junior researchers should be set up. This should be done by year 1. Encourage consortium participation in EDCTP forum, literature review policies for the issues raised by stakeholders. This should be discussed at the end of year 2. And then we need to have annual reports and minutes with policymakers at national and maybe district levels. This should be a continuous deliverable. Thank you so much. That was all from Work Package 6. Over to you. Chair.
Thank you, Josephine, for that brief presentation. I think the key is for the Secretariat to make sure that we have some of those deliverables so that we can also monitor ourselves and make sure that we really meet those timelines, because I think this has been a problem, so that we end up with a lot of pushing from the Secretariat. But I think if we have those timelines in good time, we just have to make sure that we keep on updating our reports, so that with the time in reaches, when you require those things, we just give them out. So thanks for that, and I hope you will circulate that to members and the heads of those work packages, so that in this round of funding, we don't keep on delaying you people in terms of submitting the necessary reports to the EDCTP offices. So I'll just give a few minutes. If there's anybody with any question to Josephine or Emily, I think it's time to bring it up. I'm not seeing any hand. And we are also running short of time. But if there's any urgent question to the Secretariat, to Josephine in particular, or Emily, I think this is the time to raise. If not, I'll take the opportunity to thank everybody, thank all the presenters who have presented their different programs for the work packages, and hope that we'll be able to meet all those deliverables in time. And I want to sort of return the chair to Bernard so that he can guide us on the next round. I can see there is a tea break after that, and then Professor Mfinanga takes up the chair. So Bernard, over to you.
Thank you, Dr. Norbert Pesho, for guiding this session now. Yeah, we shall take, I don't know what the time is, maybe, okay, it's 26 past midday. If we take a 15-minute break to 20 to 1, I need to be very careful because working across lunch can be challenging. But I want to suggest that that we skip the session or the breakouts because of time. The breakout sessions, which would supposed to run from midday to 1:45, where the work packages were supposed to break out and discuss the activities. And I want to propose to all the work package leaders that in the next 1 month, you organize a meeting, whether it's going to be Zoom or whatever, where you can actually discuss these activities. It doesn't have to be long. Since the activities are basically almost highlighted in Annex 1, it's about agreeing on how we are going to implement. So that will help us catch up a little bit of time so we can come back and discuss things around the Scientific Advisory Board and the other management bodies. So can we take a break for 15 minutes, come back at 20 to 1 to have that discussion. And I'll request that since Professor Mfinanga was supposed to take the chair, I will also take that chair when we return at 20 to 1. Thank you very much.
Thanks.
Professor Mfinanga, are you online?
Yes, I'm online.
Yeah, we can start the meeting.
Yes.
You are the chair. And
yes.
we would be happy to see your video.
Yeah, I will open it. But before we start, we have like 3 sessions. The one exactly starting now is on the committee meeting, and I don't know how we can break out since we are mostly virtually. So I'm not quite sure if
Prof, we agreed that we skip that one.
Or proceed to term of reference. Yes, Bernard?
We agreed that we skip that one.
Okay.
And
so
discuss the next one.
Yes, so I would like to invite the one who will be at least lead or make a presentation lead on overall project coordinations, and we in such a way that we discuss the term of reference for Eaccr 3 steering committee. Not sure who is taking the lead so that we can discuss. Do you have arranged from the Secretariat someone to at least present the term of reference? We discuss, or we just brainstorm? Bernard, please.
We hadn't prepared the slides for that, but I think I'm trying to get Emily to open the Annex 1, because we did put in a few things there. Then we can read off and the others can put comments.
That would be great.
So as Emily opens the Annex 1, I think the underlying point here is we're trying to identify people that one can actually participate in reality, because Eaccr 2, I think we chose heads of institutions and representatives from ministries of health. And if I remember well, apart from the representative from NIMRI, it was almost impossible to get the other members on the advisory committee. So we're wondering if we could get a little bit of lower profile people, but who can still do the role of oversight and advisory. And again, of course, we'll need a northern partner representation. I hope we have some northern partners still online. For me,
yes, and I remember, Bernard, you had circulated the email several times for the members to contribute. So since we are all here, I think we should really make a productive comment or suggestion on this issue.
Yeah, I mean, we can raise points if anybody has something to say as Emily scrolls down the Annex 1. If you have a contribution to this, it will be very welcome.
Members, we should hear from, especially from the work package lead. Kavishe.
Prof. Sayuki, I was out.
Yes, Eric, you are.
So what do you want to hear from us? Sorry for taking you back.
They will be presenting the term of reference for the steering committee. But if just you have something in mind that you would have wanted to really be there or considered while they are working on displaying the slide for this.
So Ben should guide us according to EDTCP. What is the standard for constituting the steering committee? There must be a guideline.
From
I think in the past.
Yes, from my experience, you need this. You need senior people that you can discuss and advise on your issues, on your mandate, and on your progress, and also contribute in terms of technical. Sometimes you can hit a challenge, then you discuss and agree, things like that. So the member should automatically be senior, but we'll have the Secretariat presenting this report to the members. That is a quick general picture of our steering committee, but Bernard can add up. And I see now we have the display for scientific advisory committee. So welcome whoever is displaying the slide.
Okay, so
can that person increase the font, please?
Make it bigger.
Finanga, I was saying in the past we had been required to get people right from the director generals in the Ministry of Health, which has not worked very well. And I think for Kenya we have never had any representative, and I promised that this time I would have to get somebody. And I was talking to somebody in the Ministry of Health who is in charge of malaria program, and I think is fairly young and probably more recent, and expecting that probably he'll be ready to move and join the committee. So we'll see what the guidelines say. But for us, I've tried my best to get somebody in the Ministry of Health involved, and I'll try to go and brief him about the ESCCR 3, so that then when he's required to attend a meeting, either virtually or in Entebbe, then he can present himself. But I think let's see what the terms of reference are for either the steering committee or what we are now referring as the scientific advisory committee. Over.
Okay, Prof. Vinanga, I totally agree with Norbert. I was also thinking of, proposing this to our, the same Ministry of Health. We have our NTD unit head overall, and is the one who leads the NTD technical working group. This is somebody that we work very closely with, that I could approach. So we will look at what Norbert. I would give priority to Norbert, approaching the malaria colleague. But should that fall, then we can have a fallback with the NTD colleague. That is if we cannot have more than one from Kenya. Over to you, sir.
Thank you. Again, quickly, from my experience, you need a mixture of members, some policymakers into the committees, but you also need people with the experience in running big projects, and especially like network, consortia, things like that. You might also need to have a member who have some experience with grant or donors or funding partners for fund mobilization, for more resources mobilization, things like that. So you will have scientific advice, some policy advice, but also how do we really sustain the network in terms of resources and so on. Yes, back to you. And I can see, let him present first and then we continue the discussion. Can you go ahead and present, please?
Yeah, okay, thank you. As you can see
on
the
program, we have like 10 minutes for these discussions.
Yeah, the SAC, which is the Scientific Advisory Committee, replaces the steering committee as the supreme guiding body. That should be Eaccr 3, not 2. And like we said, the change is just in the naming, but the functions remain the same. We thought that the name Scientific Advisory fits. Guys, my screen is going blank here. Fits the oversight role that it will be providing. And its biggest role is to provide guidance to the Project Implementation Committee on matters of science and policy. And we are saying that it will be composed of 9 senior researchers to be nominated generally by the heads of what? Of the work packages. They will include a representative from the northern partners, 1 representative from each of the 5 work packages, and 1 representative for the other states that do not host work packages. So ideally, that is the idea we have. I've not seen representation from Rwanda, so it's going to be very difficult for Rwanda and Kigali to nominate. But maybe we'll talk to Stefan and see what he thinks. And we are saying that they should have extensive expertise in research in our key areas: NTD, HIV, TB, malaria, and training. But like Professor Sayuki says, we need a mixed match of people from policy, people from project management and grant management, and maybe people from research. 9 is a huge number, so we can help. Again, the overall project coordinator usually joins as this secretary, and always there is no voting powers. Anybody wants to add to anything to that?
I think perfect. I think you have said it perfect. Only that we need the other mix of, like, the other discipline that are important.
Yeah.
You make them all. You mentioned
we shall add that. We shall add that.
Yeah, members. Let's have some input maybe from members. Eric.
Yes, sir. How are you, my city?
Yeah. Welcome. Karibu.
Asante sana. So you want me to comment? Okay. Yes. I think the good thing is that each work package is supposed to endeavor to produce one. So I'll definitely approach Dr. Matendechero, who is the overall NTD unit head in Kenya. That is the Ministry of Health. Probably we are biased to Ministry of Health in Kenya, and that is the similarity between my proposal and OPESHU's, that is where policy formulation is done. So definitely, that would fit the mix of, experience and somebody who's involved in policy.
Okay.
Yes.
Nobody, do you have some more additional points? Issue?
I think Steve had a comment.
Said earlier, we have had a problem in that we have not had representative in the steering committee before, and I had sort of committed myself to make sure that this time we have somebody. So I've been trying to see who can represent, and being biased towards malaria, and I was given a name. Actually, I've not met this gentleman, but I was given a name of Dr. George Midhuka, who is also the head of the National Malaria Control Program in Kenya. He's also based at the headquarters in Nairobi. So if it is allowed that if every work package nominates somebody, then I'll nominate him, and then probably Dr. Mwoki will nominate the other. But also we have Steve Fondiga, he's raising his hand. Maybe he has some other issues or comments related to the Kenya representative. So for us, I think we already have these two people. Dr. Mandichere, I think, has had a lot of probably experience in terms of research. I don't know much about Dr. Gizuka, whether he has an MSc and an MBCHB. So I don't know how much, I've not seen his CV. I don't know how much he has got involved in research, but I know Dr. Mandichere has been key in the filariasis activities in Kenya. So if it is allowed, then we'll have to nominate those two and see how they're going to work together, because they can be representing each other wherever there's a meeting. That's my comment.
Oh, thank you so much. Thank you. Taking that into consideration. The Secretariat is taking that into consideration. Maybe we can have Steve and then Kavishe.
Yeah, thank you very much, Chair, for the session, and thanks, Ben, for the presentation. I wanted just to give it a different outlook so that we know the areas that we are targeting. So when we are saying members should have extensive research expertise in these key areas, I think let's think regional. I also wanted to ensure that we can consult regionally so that we are looking at the powerhouses that have led HIV, TB, malaria, NID, and training. And I'm sure within this consortium, we have those names, so that as opposed to sticking to Ministry of Health, we need to ask ourselves, outside the Ministry of Health, are there some names of people who we feel can also steer Eaccr 3 to the next level? Of course, including those Ministry of Health, but I wanted to say, can we broaden it so that HIV, who is the name regionally, TB, who is the name regionally, malaria, NID, and then when it comes to training or capacity building, who has been able to do much? And I think when we leverage and piggyback on some of these names, then we know that our fundraising agenda is definitely going to take another projection. Thank you.
Okay. And the other thing before Kavishe comes in, those people, I think in terms of expertise, it would be nice if we can have like NTD expertise, TB expertise, HIV expertise, also NCD, because we are talking about comorbidity expertise into the committee. So Kavishe and Bernard, if you agree, we can combine the discussion and the election. You see, so it will be like 20 minutes. 10, we can combine both of them here, because like they are related. Is something that is very much related.
Yeah, and I can see Kenya has already nominated 2 names, so it's okay.
Okay. So okay. Go ahead.
Thank you. Yeah. So I was saying, I quite agree with the previous speakers. I think we let's look within and outside the ministries, and come up with the names of those who are experts. I think being an expert in an area is important, because then they know exactly what to approach, and they, in case of advising, then they can give specific advice on important issues regarding the network. So I quite agree. I think I supported the previous ideas.
Okay, and there is a suggestion or a question at the chat. What is the process for involving additional interested sites? Members can nominate names of SAC and send it to the Secretariat. Okay, that was the Secretariat. Okay. I think the other issue is, what is the process for involving additional sites? Maybe Bernard, you can help there a bit.
Prof, repeat your question. I'd stepped out a little bit.
Yeah. What is the process of involving additional interested sites? I'm not quite sure whether this is connected to the steering committee or maybe something was.
No. That definitely is not connected.
It's not related at all. Sorry, it's something I raised earlier.
Okay. Okay. Excellent. Fine. So Bernard, you wanted to say something?
Yeah. I was saying that since Kenya has nominated, I don't know whether the other, you people in Tanzania, between yourself and Kavishe, if you had thought up other people for Tanzania. But I was here silently thinking if Professor Kibiki is free from the East African Health Research Commission, maybe he would be a great person to invite to be part of this team, since he was involved with us in the Eaccr 1 and 2 in some way. I don't know if the team in Moshi can contact Kibiki and see if he's happy to participate with us. But I thought he would be a great resource, knowing the East African terrain quite well, having worked there for a while.
Actually, that one can be East African health desk at the policy level representation. Yes. From the East African health desk. It can be like that. And if that is so, maybe you, the Secretariat, can contact at that high level, representing the East African health desk.
Yeah, we can contact him, of course, but personal contacts make it easier. So the guys who are closer home can have an informal discussion, and then once we can pick his mind, if he's interested, then we can make the official communication.
Okay.
Yeah.
Good. I think we had also nominated someone earlier. We have earlier nominated someone from Tanzania, right?
Yeah, we used to have Dr. Urio from
NIMRI. Yes.
Ndecha, Urio Ndecha.
Yeah.
Or right. I think, is it Ndecha or Ndekia, something like that?
Ndekia.
Yeah.
I think I was of the opinion also of suggesting her, because I think, I don't know your opinion, but I think she did a good job. I'm not sure.
Yeah, sure.
Yeah, she engaged and she participated quite well. So
she was coming to the meeting, you see.
Yeah, she came to all the meetings actually.
Mm-hmm.
Yeah, so.
And because it's a lady also, in terms of Uganda, we are winning there.
Yeah, sometimes we forget that. So,
we have Tanzania, we have Uganda, we have Kenya, we have.
No, I think for us we shall continue with Dr. Raro from the Ministry of Health, with the Commissioner for Communicable Diseases at the ministry. So I think for us that covers us in wide aspects for everybody. And of course, the director here is a member by virtue of his being the overall project coordinator.
Sure. I'm not sure about Ethiopia.
No, I think we then need representation between Kigali and Sudan. Of course, Sudan is still troubled waters, so it might be a bit hard. But we shall talk to Janssen from Kigali and see if they can identify somebody to represent Kigali and Sudan. And then we need representation.
Of course, Ben, Kigali is my other home. If Janssen doesn't give you someone, I'll be happy to suggest.
Eric, we didn't know you have dual citizenship.
Don't worry about it. You
Okay, yeah, but I think you then have to work very closely with Stefan, because he's the contact person for Kigali. We can't do anything without his involvement.
Yeah, I agree.
So, do we have any Northern partner representation? Yes, Nicole. it seems I'm hijacking you on this one, but any thoughts about who could? Previously, we had somebody from AIGHD, and I think Frank Koblenz did attend once. Constance did attend, so I don't know if we have any other people who are representing the North. And
I think you are okay. There's people who attended the one you mentioned. They are good as well. There is an additional one. If we actually agree and participate, is a highly resource person, very much experienced. Is Sir Professor. You know, this Sir was awarded by the is a very high rank that in UK you are awarded by the I don't know. Well, Queen. Yeah, the Queen. Yeah. So, but he has been very active in terms of research, promoting and mentorship.
This is a new network grant.
African people who are coming, scientists. Professor Zumla, if we can manage to maybe write and convince him, he could be a potential resource person.
Professor Yoki, Professor Zumla is high profile,
Yes.
very, very high profile.
Very high profile, yes.
He seems to be a very busy person, so getting him, I mean, we tried, especially in EACCR too. We kept trying to bring him on board, and we were not successful on several occasions. So I don't know, because that's what we suffered in EACCR too. We selected high-profile people to this board, and unfortunately, we didn't get any attending. So I think, yes, he's very resourceful. Capacity building, he's done a great job, but I'm not terribly sure he will have the time for us, going by the experience we've had before with him. Yes, Nicole?
Yeah, can you hear me?
Yeah.
Yes. I was also thinking perhaps, given that there's going to be expertise from the work packages on the diseases, it might be interesting exploring for the northern partners, perhaps on research areas. So for example, an expertise on data management, and it might be of interest, perhaps the team with Edo or Amsterdam can also suggest some names so that we make or ensure that we have all the different expertise within the steering committee. Another suggestion, I put it in the chat as well, but maybe to discuss, is if we want to explore as well within EACCR and the countries, but also if we want within the SAC, some of the members of the other African networks of excellence or alerts that might also help with the coordination between the networks across Africa with the dissemination and the policy advocacy. And that might help steer the direction for EACCR. So those are perhaps my two comments. I think, I'm not sure if Elizabeth Allen from Edo, but if not, maybe it would be also good to discuss with the other northern partners to see what they think about this idea. Thank you.
Okay, so Nicole raises very interesting points. The issue of looking at the areas we want to strengthen in the network. So having representation of somebody with expertise in data management, and since this is the northern partners supporting this, then maybe somebody from EDO or AIGHD might be a good idea, and I think that's welcome. Then she suggests maybe having somebody from the other consortia as funded by EDCTP, like Pandora and Alert, right? I mean, Sayoki, maybe that's where Zumla can come from, because Zumla, I think, is with Pandora And it's basically the brainchild behind Pandora. So,
yeah.
I mean, we can try if we can get Zumla to represent that, because maybe they have a bit of expertise that we may not have here. That would be an interesting one. Although I would say we need to have. Yes, please.
I also participate in Pandora, and indeed he played a very great role in terms of leading and giving very good idea and leading as well, because he's known. He liked Pandora very much, but he also liked our network. He has been writing to me personally. The issue with the ESR too, that he didn't have enough time. But if you could contact him to commit, and if he says no, of course we can. If he says he will have no time, then we can proceed with the other things. But having him is a key. He has a good connection in terms of really more sustainability, in terms of more resources, in terms of transitioning between, you see, you are being funded, but if the fund stop, when the fund stop, has a very good, very good constructive ideas and supportive.
Yeah, I think we can keep Prof. Zumla. He's good. He's very resourceful, definitely, and I think my bigger concern was his availability. But I think
indeed,
Prof. Sayoki, you have a better working relationship with him, so you could drop him an indicative email to see if he's happy to be with us on our scientific advisory committee.
Indeed, we could have like a Zoom meeting with you, the Secretariat, me, and the Zoomla, so that he can express his commitment. Really, it's very good, and I do agree you are concerned about the availability in the past, but we can arrange and discuss. We can leave it open, but we can add another northern partner that is not a very high level into the committee. I think is okay.
Yeah, Elizabeth, is this Elizabeth Allen? Okay, maybe not. So I'll leave it between TGHN, IDDO, AIGHD, and Karolinska Institute we'll try to create a loop for you people to come up with a name that can, you know. So we have Prof. Zumla, who is UCL anyway, and they are part of us. But also, if you can find a second name, then we can see between those two who will be representing us.
And the other option, Bernard, would be to have both of them, because you know the level we are talking about, Zumla, is very, very high level, and it has really advantage in terms of really making our network popular, but also sizing more resources. But we could have someone else coming in from north. I don't know if it was strictly to have only one person.
You want to avoid the bloated committee, because when it comes to decision making, it can be a pain, and also raising quorum can be a problem. But I think it's an idea, since we are at a level of forming the committee, as the Secretariat will eventually give the names that have been suggested, and we can see who responds positively and not. Having said that, I'm thinking, since we are big on capacity building, we need representation from, of course, Zumla will be perfect for capacity building, but we need you know, some other people who have been in this business for a while, and I could be corrected if I'm wrong, but if we got someone from the Africa Academy of Sciences, I'm saying this, I don't know anybody there, but I think they've been doing a great job on capacity building for scientists in the region. So if we could get somebody there from the Africa Academy of Sciences, The other group that I'm thinking about that probably was quite successful is the Thrive Consortium. I think Rignold was quite part of this. Again, if we could get somebody from there, although their pitch is mainly in training PhDs and masters compared to what we are doing, but maybe we could get a bit of good resource from those two groups. I don't know what the other people think. Yes, Nicole?
Maybe for ASS and Kevin Marsh.
Kevin Marsh?
Yeah, because of his background with malaria and working within ASS and capacity building.
Okay, that's a good name.
Maybe the Camry team as well, if they are still online.
Yeah,
they can say what they think.
No, but what do you think about Kevin?
I mean, he was part of the initiatives when we were starting the Eaccr. So I don't know whether what he'll feel about now being moved to advisory, but he is. I think he's available. But what I'm saying is that him together we're in the initial program of starting the Eaccr. So I think he's still available, and as Nicole says, quite good in terms of malaria work. So it's a possibility that we could contact him on that line so that he becomes a member of the advisory committee. But we also need to find out his commitment at the moment. The fact that he is in that academy, but I think he's also more attached to UK than he was when he was working with us here in Kilifi. But I think as other members are also outside of Africa, I'm sure if there's a meeting, he can make himself available. But so we could give him a chance.
Okay, thank you.
That's my view. But he, as I said, he's the founder of the Eaccr.
Okay. I don't know, Bernard, but I think time now we are out of time. They allocated time, but if there are still some burning issue, I think we have a list, and we have several suggestions for northern partner that we can pursue.
Yeah, Emily, how many names have we listed? Okay, so we have about 10 proposed names. We need 9. It's a dangerous way of living. If 2 refuse, then you're short. But anyway, because we still have to contact Steph Jansen in Kigali for a proposal, and Eric says he's going to help us on that. Prof. Kavishi, I was thinking you could get us somebody else to cater for training, other than Kevin, and other than Urio from Tanzania.
Okay, Bernard, I don't know, you discuss. I'm just proposing. We know, I don't know how many know Dr. Andrew Kitua. He was the former director of National Institute for Medical Research, but he is now a director of USAID. He worked in Kenya directed in a program in USAID. He worked in Kenya. He had office in Uganda with the USAID. He's a senior person, had a lot of experience in malaria. I don't know if maybe we can just add the name there, and then, as you said, we still have, so that we have options. I don't know. The malaria people are here as well.
Okay, maybe let me suggest that put those names in the chat. it will be easy for us to pick them, because some of them we had the pronunciation, we're not terribly sure we know the spelling. So Eric, Norbert, Professor Yoki, you've nominated 2 people. I think
Yes.
we still mentioned
Yes.
Dr. Ndekia. We mentioned Dr. Laro for Uganda. So let's have all these names, and then for the different people that have nominated the names, please make the contacts, the first informal contacts, and then let us see if they accept, then we can write their formal letters. Okay, I think that's about that. We need to conclude this. It's 1:45. Are there any other comments that are pressing?
So, sorry, Bernard, there are questions I think Ken raised on the wall. I thought maybe this could be a good time to look at them. Thank you.
Do we remember those questions? I know one of the questions was how are students selected? I think generally as the network, we will usually advertise network-wide, and the different work packages or the different country representatives would forward the names to whoever advertised, and the shortlist is done, and then finally selection is done. So that is the general approach to everything. However, previously, especially for the long-term trainings, because the fundings were not so good, remember there is no tuition that is paid, and there was always little money. What was happening is that different work packages or nodes then would identify some students, at a work package level that they would support, and the student would then do some work with the work package. And so this would be the headhunting approach. But the general thing is, there's advertising, and there's an open selection system. If there is enough funding, the problem is when the funding is little. When you put out competitive things, people come expecting a lot of money, and when they don't find the money, in the HIV node we headhunted a PhD student to support the GIS work. And we got somebody from, I think, Arusha, with the support of Marion and Jim Todd. So the person came on board, we did the initial training, supported him to go and do a bit of courses. I think when he realized the money was so little, he disappeared. Even his supervisors could not trace him anymore. So sometimes you have to be very careful when, you're trying to get the best talent and you have little money. So that's how sometimes the headhunts are a little bit better than opening up completely. But the general approach is the advertising approach.
Supporting Bernard, the funding has been really the challenge of doing a comprehensive, competitive, advertisement. For instance, for the KFC, the candidate for KFC, because we have enough funding there, you see, it was really very competitive advertisement, short listing, and we are going to do interviews and so on because we have full funding. For the problem with this one is you don't have full funding. Sometimes you have only funding to support research work for a master or PhD, and therefore you need to have a candidate who have other sources, or you also need to have, or perhaps the supervisors or the work lead need to have another project that can complement in order to be successful. That has been the challenges. I quite agree with Bernard.
Okay,
thanks, Bernard. The question actually Ken asked is still on the chat. He was saying, through the chair, just seeking a quick clarification from the HIV Work Package lead on 2 issues. The short studies are then multi-site.
Frank, can you say that again?
Yeah, so I'm just reading from the chat. He said, through the chair, just seeking a quick clarification from the HIV Work Package lead on 2 issues. The short studies, are they multi-site or site-specific? And then I think if they are site-specific, I think he's saying what's the process of involving additional interested sites?
Okay, so the short studies for HIV, like we said, this comes way back from the time we're writing the proposal. And of course, we always come up against these kinds of things every so often. So at the time of writing the proposal, it was open and people brought ideas. I think initially we had 5 studies proposed. 2 of them fell off along the way because of funding. And the 3 that remained, it's because people had proposed. And I'll tell you, there's not an awful lot of money. I think each of them has just around about 60 to 70,000 euros to conduct this. Now, with 60,000, you can't do a study in many sites because it will disappear in overheads of these sites. So I'll say, for instance, the comorbidity study, HIV and comorbids, I think it was frontiered by NIMRI. And I think because they're already doing some work between HIV and diabetes, so it's kind of going to, ride on that foundational platform. And so the little money can then support it. I think they're supposed to do it with another site, which I don't know, but it's supposed to be, NIMRI is going to lead on that one. The mHealth study is between KCRI and Zambia Hospital. They've already been doing this even in ESCCR too. So it's the same platform, same people, probably improving on the pre-existing protocols. The adolescent health and mental health work, like I said, is supporting the PhD student in MRC, and it's going to be working together with Kigali because Stefan is very strong on mental health. So it's that kind of arrangement. They came a bit, came from how the proposals were written. So it might be a bit challenging to have an extra site added to that, unless you work with the investigators of a particular study, express interest, and see if they can, use an alternative instead of what had been thought before. Thank you. Norbert?
Just making an observation. I'm seeing a lot of commitment from Nicole, and I was wondering whether she could be one of our members of the advisory committee. I don't know what she'll say about it, but I can see the commitment she's putting into our activities.
Nicole, you're here, so please pronounce yourself.
Thank you. Thank you very much for the nomination. I would be glad to support. I just think perhaps we need people with more expertise within the steering committee, but I would be happy to attend as a non-voting member and support from TGHN side as well.
Thank you, Nicole, for that offer. I think we have one, unless otherwise we have a confirmed member. Never mind non-voting.
Yes.
She says she's happy to support and participate, but as a non-voting person. So we are happy to have you. Thank you. Yes, Marion, I can see your hand is up.
Marion, oh, is it an old hand?
Yeah, yeah, I have a point for discussion. 2 weeks ago it used to be alumni meeting, and there was a major discussion, and I raised this issue before in EACCR2 as well, on the support that the IGSP fellows are getting from the networks. And basically all the networks are not really supporting their fellows. And I don't know if Michelle already raised this issue towards the Secretariat, because that was the plan. But I think we need to put more efforts in the fellows, maybe as a senior fellow plus. I'm not representing a lot of fellows, but we should find a way really to do that. EDSP has put that as a major agenda for all the networks of excellence.
Thank you, Marion, for raising that. It's a big concern that they've always asked. I think the bigger challenge is it's difficult to expect the networks to support people they don't know because these fellows do not apply through the networks. And they are given the awards without the network's knowledge. And we are never told who these fellows are. So it becomes very difficult for us, to go and look up some fellow in Kenya or in Tanzania and say, look here, we are ESCCR and we are supposed to support you. So I think that for me, the honor still lies with EDCTP to link us up. For the fellows in Uganda, we've tried to support to the extent possible. Those that have come through and they need support, we've supported them. Those that we are aware of, we do support. But because they give quite a number of fellows, and we cannot say we are going to be exhaustive. So if EDCTP can create that link, then maybe it's going to be possible. What I can say is I'll get in touch with Michelle, and maybe we have a conversation around that area as networks of excellence with the other project managers to see how we push that forward. Because it's, Marion, we know you, so we worked with you.
Because there's a huge platform created by EDCTP that they have even promoted a lot in all the newsletters, and you cannot say we don't know our fellows, because you can just click Uganda and you get all the fellows in Uganda with their contact details. So I don't think you can say, right, like, we don't know the fellows. It is really the way it was being said also in the alumni platform, it is really the role of the networks to actively reach out to the fellows. And currently, the only ones who are actively involved in ESCCR are Uni and me. And but there are many more. And
yes, but how do you think who should approach the fellow? Should the secretariat approach the fellow, or the fellow approach the secretariat?
Exactly, Pro Sayoki. I think if you are a fellow, it's also the honors also is with you to reach out.
Yes.
How does the network know that you have a need?
I think, Marion, this is appreciated, and I know that EDCTP has been making noise about it. But the honest truth is that there's been no formal processes for this. So it's discussed and it's left hanging. The fellows are never told they have an obligation to work with the networks. The networks are told you have an obligation to work with the fellows. But there is a platform, there is a website, there's a link where all the fellows are. But I think it's difficult for us to go and say, we are the network of excellence and we're here to work with you, if EDCTP, who is funding both entities, is not taking that initiative to link us up together. But what I'm saying is that I'm going to take it up with Michelle. We shall meet as project managers with EDCTP, and then we find a formal way. I'll give you an example. We have a fellow here. I had ethical issues, and Michelle Singh actually advised the fellow to reach out to us as the network to get support on that. And the fellow came, and he was helped. So it was difficult for us to know that this fellow has these challenges. But once he was advised by EDCTP where they can find the help, they came and they received the necessary help. So I think that linking up of the two parties is what is missing. We shall take it up at a higher platform and see how that can happen.
Bernard, time is really over.
Yes, I want to invite Professor Caleb to actually come and give us closing remarks. I think I can't say we've been exhaustive, but we've tried to discuss as much as we can because time, it's 2 minutes to 2. I think we had promised to finish a little bit earlier than that. Professor, you're welcome.
Okay. Welcome, Prof.
Yes, colleagues, let me take this opportunity to thank you. Thank all those who have been connected for the 2 days, colleagues who are here physically present. I think this has been quite a successful launch. We are very happy. A lot has been discussed. Unfortunately, I missed it, a lot of it, because of other meetings taking place at the same time. But I've been following online briefly, and also with Ben informing me what is going on. I thank you all colleagues who have connected. I know you are all very busy, but at least you have given your time. You have taken this very seriously. It gives us assurance that as we move forward, you'll actively participate so that we can consolidate and sustain and even strengthen the achievements that we have gained over the years. I think we all commit ourselves to make our contributions to the objectives of the EACCR, and we shall always be there. I want to thank once again EDCTP for the funding and the support. I thank the Secretariat for the work you have done to make this launch a success, and all others who have contributed. And I'm aware we are really running out of time. It is therefore my honor to close this launch and to wish you success as we implement our activities. Thank you, and for those who are here, let's go and have lunch. For those who are far away, also go. We are different time zone. Some may be going for break tea, others are going for lunch. So thank you so much, and let me wish you all the best. Over.
Thank you.
Thank you, Prof.
Thank you, bye.
Bye-bye.
Bye to everybody.